Hey everybody, it's Miguel again. How are you doing? All right, hopefully everything's going well with everybody here. And I'm doing pretty well myself. Oh, so I went to Amazon today and I discovered that the masks, that is the KN95 masks that Amazon.com sells, they're way down in price. You know, they used to be like $3, $4, $5 a mask. Serious, $5 a mask. In fact, I was buying masks at my local Ace Hardware for $5 a mask for a KN95. And um, so I'm glad to see that the masks are down to like $1.80, $1.60. I even saw masks down to $1.30 per count, right, for each. So I'm really impressed. So I went and picked up, I don't know, 20 or 30 more KN95 masks. So I'm really happy about that purchase. So glad that the mask makers, that they're ramping up production all around the world and making it happen for all of us folks out who are down here trying to survive in the midst of this virus when there are huge numbers of infections going on all around. So I'm speaking of the huge numbers of infections, I got a new product in, was it yesterday or the day before? And they were Clorox wipes, so I can use them to wipe down my cell phone and my keys and my steering wheel and stuff like that. You know, these are just regular precautions. A lot of people used to use wipes even before COVID to wipe down things like their cell phone and stuff, or at least some people did. And then I also I don't know, I've been looking for some kind of eyewear, some kind of eye protection that I could wear that would be a little bit sort of less suspicious, less like goggles, less like a face mask, or less like a face shield, and more like everyday glasses. And here's the thing. One thing I'm realizing is that I just love wearing my contacts. I get better vision from my contacts than I do from my glasses. And I don't know if you recall, but that period of time that I went just wearing glasses was fine, but it's kind of tough because I had to adjust to less clear vision. And I think that my glasses are really just up to snuff. I think they are up to snuff in terms of their prescription. It's just maybe I think what I'd need to have is it'd be nice for me for those glasses to have close-up glasses integrated, right? Like so far vision and close-up vision too. But like bifocals, for example. But before I get that, you know, I was thinking, well, I like my contacts so much. Why don't I just get goggles that look like glasses, but the lenses don't have any prescriptions on them? Then I can wear my contacts and I can walk around with these glasses on. Even though the glasses are just glass, they don't have any prescription in them. I think that might be a way to go. Certainly if the glasses look pretty good on me, which I hope they do. So anyway, it was a cheap solution, 14 bucks. And who knows, I might find that I enjoy wearing just the faux glasses. So anyway, that's an idea. So as you can tell, I'm just trying to figure out my way around this whole situation. Oh, excuse me. And so anyway, what's going on with you? Oh man, so what's kind of interesting, I'm fine with staying at home all the time, but let me tell you, there are periods of time when, you know, boredom can set in. And particularly, you know, I'm feeling restless, I got energy. It's hard to stay inside the house all the time when you've got energy. So you want to do stuff, but there's just nothing to do. There's no place to go. You know, especially at nighttime, right? Because it's winter. Like, there's no place to go. Can't go to the movie theater, can't go shopping, can't go grocery shopping. It's like, what can I do? So I guess what I could do is I mean, there are places like that I could go, but why, right? Like I could go get some ice cream, or I could go to a coffee shop or something like that, but why? Why? Why do that? Besides, there's actually a part of me that is appreciating all this staying at home because I'm saving money, which is pretty cool. I know. I guess I was reading a news article today, and it mentioned that uh, when this um, lockdown ends, that there's going to be like this splurge spending, and I think that's true. I think there's going to be an amazing amount of splurge spending. People are just going to go throw down thousands of dollars on cruises, throw down thousands of dollars on ski vacations, and and trips around the world. That's just the way it is. I think after being cooped up for a year, listening to bad news, we're going to be all out having a blast. And so I'm really excited for the latter part of 2021. I think that is exactly what's going to happen. People are just going to start using all of their vacation time, and they're going to just start living it up, at least in the latter half of this year, because like I said, we've been cooped up for a long time. And now, of course, that won't happen for everybody. There are some and this includes myself, I think of myself as an extrovert, or maybe even just a non-shy introvert. And what's interesting to me about that is that, I'm really learning how little interaction I really need. I don't really need a whole heck of a lot of interaction with other people to be happy. And this pandemic is helping me see that. Just how resilient I am in the face of isolation. Now that's not to say I'm isolated, because I'm not. I mean, I live with my girlfriend, who I see basically all day, every day, and sleep with every night. So, I mean, I've always got a partner. I've got companionship, which is a lot more than a lot of people can say during this time. A lot of people don't have companionship, and they haven't had companionship for a year. And I can only imagine how they're going to respond when the lockdown ends. I mean, what what are they going to do? I don't know. Who knows? Maybe there's going to be, who knows what's going to happen. Maybe dance parties in every city, every Friday night. I don't know what's going to happen, but I have a feeling that things are going to be a little different. But I'm not sure than they were before things started out. I don't know. I'm really kind of interested to see how things are going to change. One thing I'm very happy about is that finally our culture, and in fact basically the world, is getting an understanding of viruses and bacteria and their impact on human health, and precautions and barriers to prevent infection. I mean, this is like a crash course in infection, and I think we're going to start taking things like the flu seriously, tuberculosis seriously, or even AIDS seriously, and hopefully also STIs seriously, sexually transmitted infections. There's just this. I can remember just this whole lackadaisical attitude that people have all around the world when it comes to things like STIs and flu infections and colds. And I'm hoping that this is going to help turn the tide, so that the medical industry and even society just starts paying more attention. Because here's the thing, I used to pay attention to the flu virus deaths every year, and on the order, they're basically here in the United States on the order of 20, 30, 40,000, sometimes 50 or 60,000, in particularly bad flu years, people dying, right? And I always thought about how unnecessary that was, particularly if there was a flu vaccine, which of course there was every year, that only like 40 or 50% of people got. Hey, if they were lucky, I think people got like 45, 50% of the people got the vaccine at the end of the day, before the season. So, I mean, that's pretty good, but it could have been better. And I'm hoping that now that we've all got a sense of just how powerfully destructive these viruses and bacteria are, that we start paying closer attention to it. Here's the thing, even things like sexually transmitted diseases like herpes 1, herpes 2. Really, we should have had a vaccine for these viruses two decades ago. Really. The fact that we even have herpes 1 and herpes 2 around is just crazy to me. I mean, now, I just think that there hasn't been enough emphasis on research and development in vaccines, particularly for colds, right? I really think we should start taking colds seriously. I'm smelling some smoke, that's all. I think someone's got a fire or something going on. I don't know. So anyway, I'm really happy that this is happening, that people are really starting to value their health. And let me tell you, the people who aren't valuing their health, they're dying. They're getting sick and they're dying. So anyway, that's kind of thinning the herd in the sense of, from a Darwinian standpoint, hopefully there will be more people paying attention to flus and viruses and their impact on human health, mortality, and morbidity. Yeah, I'm absolutely thrilled by it. By at least that piece, right? Which is a small piece. Because on the whole, what's going on is horrific, of course. I mean, that doesn't even have to be stated, right? What it's doing to our economies, what it's doing to individuals, the amount of suffering and death and dying that's going on right now is just off the charts. And what's equally tragic about it is that so much of it is unnecessary, right? But our culture, our society just doesn't have in place structures that would alleviate some of the suffering. For example, people who are sick, they sometimes have to go to work. Regrettably, maybe they're the only. And you might be thinking, oh, that's not true. Oh, it's certainly true. There's a lot of people who are living paycheck to paycheck in the United States. And if they have a family, and if they are the sole provider for that family, certainly if they have children, those people are going to go to work even if they're sick. They just are. And honestly, I don't blame them. Society in some ways has failed them in the sense that they can't, even if they have a very contagious disease, they're still going to go to work. And that is a societal problem. It's actually not an individual morality problem. This person going to work is making the right choice. He needs to feed his family. Or they need to feed their family. They're making the right choice. This is not, when it comes to, but really they shouldn't be having to make that choice because our society is just ill-structured. We need structures in place so that people can keep not only their own families healthy, but can keep the rest of society healthy. It's about investment and return on investment. These kind of changes, who knows what it would be. I don't know what it would be. Maybe if a person is sick, some kind of basic annual income or something like that. I don't know. I don't know what the solutions are. We got to get creative as a society and pull this off. And there's also other things too. Our medical system is taking a real hit right now, particularly since, and these are from reports that I've heard, that hospitals can't do outpatient surgeries anymore. They just stopped scheduling that. Apparently, and this is something I didn't know, outpatient surgeries are a big profit maker for hospitals, and it's basically how they stay afloat financially. Well, of course, naturally, all these hospitals have had to cancel their outpatient surgeries, or many of them, to the detriment of their finances, and certainly to the detriment of people who need and want those outpatient surgeries. I mean, I crunch and shudder at the thought of people who've got, say, cancer and need chemotherapy and they can't get the infusions they need because the hospital's too overbooked or whatever. Because I'm just making this up. I don't know if that's the case. I don't know if chemotherapy infusions are affected by COVID, but I imagine that they are to some extent. But there's more things. There are people who've got tonsillitis, right? They need tonsillectomies, right? And basically these people are getting fed antibiotics, right, to keep them, and basically that is suffering, right? There are people who are suffering. They need surgeries now, whether it's a knee surgery or hip surgery or who knows what that is they need. Maybe they need a kidney transplant. I don't know. Although that's probably an inpatient surgery. But still, I'm sure outpatient surgeries are critical. I think they're important. I think that people need to have them. I mean, my mind shudders at all the outpatient surgeries that need to happen that people aren't getting them. So, I'm not even aware of all that. And then, here's another aspect of it. There's a lot of what goes on, and I'm certainly not qualified to talk about these subjects, but I figure I might as well just talk about them a little bit. And it has to be this testing. I'm sure that people are delaying their colonoscopies, and so they're not being diagnosed with cancer like they ought to be. They aren't being diagnosed with heart disease like they ought to be. People are not being diagnosed with all kinds of problems, epilepsy, schizophrenia, depression, anxiety. They're not being diagnosed because these tests aren't happening because people are avoiding hospitals. They're avoiding clinics. And so this is just a huge tragedy. It's a huge healthcare tragedy that's going on right now. And here's the thing. I recognize it as a tragedy on a scale from 1 to 10. It's probably like a 9 in my evaluation. Of course, I'm ignorant, and I recognize that. And I am not, that's right, and I'm ignorant. I'm sure that there are people who are more knowledgeable about this subject, who really grasp the problem at hand. And, this is going to create lots more morbidity and mortality in the future. It's really going to have an impact on life expectancy here in the United States and all over the world. And it is truly a tragedy. Hopefully, what I'm hoping is that now that we know what's possible, that we'll start retooling our healthcare systems. Because I also believe that this COVID-19 thing, this thing could happen every 100 years. But I also have a feeling that it's going to speed up. That is, the frequency of problems like bacteria and viruses and fungi and everything else, like prions, for example. I think because of global warming, things are going to be sped up. I mean, I've been hearing reports in the news. I don't know how credible they are, but when the permafrost melts, it's very easy to understand plant viruses, animal viruses, that even maybe bacteria viruses. Who knows what kind of viruses are being unearthed? And certainly, yeah. And, viruses can hang out for, I don't know how long they can hang out. Who knows? It may not be more than a couple thousand years. Because I know that DNA breaks down over time. It's not, you can't preserve it perfectly in ice, but you can preserve it pretty well. And I really do see problems like these biological organisms being a problem here in the world more frequently. I really do see it. And thankfully, technology is increasing at a pace that we're able to acknowledge it and track it and take steps. Thankfully, we've had the Industrial Revolution over the last 130 years. And so, but anyway, we're definitely going to need to get our act together in our society because we want to reduce suffering. And it's kind of funny, it's in everyone's interest that we do, but looks like we've been focusing on things that are unnecessary for the last, I don't know, 50 years. Like unnecessary violence against one another, unnecessary, I think there have been some unnecessary things, that, just poor decision making. So anyway, that's my wish, that's my hope for the world. Talk to you later. Bye-bye.